Well, I think I saw some of the glimpses of that when I was still working at Group Health. We had one of the first patient portals in the country that was actually transacting clinical business, clinical information between providers and patients. And it was fascinating to see how hungry our patients were. And it was also fascinating to see the cultural backlash. Lab results is the relatively simple, trivial, but elucidating example of, as a medical group, we felt like we can't release our labs to our patients without us looking at them and having a conversation first. Now, Group Health is a consumer-governed organization, so the board of trustees are all consumers, and it was a consumer-established organization back in the 40s. So the patients were very close to the organization, and there were a lot of modes of interaction. Well, what they told us so crisply, loudly, clearly was, we don't need you as the barrier between us and our information. What we need you as are the collaborators, the consultants, the partners in our care. And so it fundamentally changed the way we thought about, a relatively simple thing again, the release of lab results. So we very early moved to the release of almost all lab results, in range, out of range, but with a lot of opportunities around that to be able to interact with the patients directly, access other kinds of information for the patients. So it was a glimpse at what the opportunities were and how hungry patients were to be included in their care. Well, I think it's a great venue for bringing together the healthcare kind of organizations, patients, and then innovators and entrepreneurs, because there's such a ripe opportunity to do more of what I just described, more access, more partnership, more of a voice in the organizations about how care needs to be delivered. Because one of the things you quickly learn in healthcare when you're in it is healthcare at its best, when it's delivered at its highest, is when we have formed that kind of partnership with patients, where they're a true part of the care process. And every time we don't do that, we end up suffering. The care's less superior, not optimized. So that's the opportunity, is how do we leverage, we're in an incredible place, we're at Stanford, we're in the Silicon Valley, how do we leverage all of the thought leaders, the technology capabilities, and truly bring our patients and invite them in to the process and integrate that into our healthcare organizations.